For the people of Haiti, January the 12th, 2010 marks the date of a profound trauma. The earthquake claimed more than 200,000 lives. 1.2 million people lost their homes. Rescue workers from Malteser International were among the first to arrive on the spot after the disaster, reaching out to the people to alleviate their suffering, providing aid to the needy, with the people, for the people. These fundamentals of Malteser International are holding true. In the first phase after the earthquake, we focused on acute medical treatment for the survivors. We had a medical team working in a hospital in Port-au-Prince. It was really about taking care of the injured and follow-up treatment of amputees, for example. In the meantime, Malteser International is running 2 health posts in the towns of Darbonne and Léogâne, as well as a logistics hub in the capital Port-au-Prince. Each day, many patients turn to the doctors and nurses of Malteser International. This hands-on assistance was made possible thanks to the support of people and companies across many countries, working with the Order of Malta's international network. Many national associations and relief services of the Order launched successful fundraising campaigns and made invaluable contributions. 2 vans and 1 ambulance vehicle, for instance, now transport supplies and patients in Haiti thanks to the help of an Austrian initiative. Everywhere in the world, hundreds of people stepped forward to raise awareness and make contributions in nurseries, schools, sports clubs and parishes. Their activities ranged from collecting money on the streets, selling homemade pastries, staging charity concerts, and collecting donations at schools. Altogether, those campaigns raised 6.4 million euros. The European Air and Space Corporation EADS provided a mobile health station from the Trans-Hospital series and covered transportation costs to Haiti. The healthcare company Mediglobe donated 50,000 euros in medical products. Readers of various German newspapers published by Zeitungsgruppe Münsterland excelled themselves by donating a combined 800,000 euros. At the health posts in Haiti, the focus has now shifted. Instead of treating acute injuries, the medical teams now concentrate on basic healthcare services for the general population. Even before the earthquake, Haiti was facing enormous difficulties in healthcare, but also in other fields. For the aid agencies, it's now mandatory to not leave the country after just a couple of months. We must stay committed to bring about real improvements in the long run. That's why Malteser International is extending its activities beyond the medical field. Alongside the Haitian people, the helpers are determined to stay involved in the reconstruction and the creation of a better future for the country. Right now, we're planning projects to support schools with tents and teaching materials so that education can resume. Apart from that, we're working on projects to provide for psychological and social assistance and for the reconstruction of health centers and basic social infrastructure, including disaster preparedness measures. Water supply and education in hygiene are further important fields of activity. Malteser International thanks all private and public donors, supporters and volunteers for their commitment. With your help, we can provide the people of Haiti with the means necessary to help themselves and give them hope for a better future.